Hello, everybody. Welcome to this free webinar. My name is Aline Yon. I'm a registered acupuncturist practicing traditional Chinese medicine, and I work at Yoga Mamas. So today's webinar is about the postpartum period, easing the postpartum period in winter with traditional Chinese medicine and acupuncture. So first, let's start with gratitude. First, I would like to do a land acknowledgement. I'm an immigrant to Toronto, so I'm really grateful to the lands and the people here who are welcoming us. I would like to acknowledge that the land we're meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I'd like to acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Also, today is a special day. Today is the 11th of November. I was born and I grew up in France, so every 11th of November in France is a bank holiday because they remember that the 11th of November is Armistice Day for the First World War. So please, let's take a minute to remember all those veterans, all those people who have fought and who have fallen so we can have a better life. I'd also like to acknowledge the people who are still fighting and the people who will fight for our freedom, freedom of opinion, freedom of speech, and freedom of our bodily autonomy. Because in the world, unfortunately, freedom is not a given. So please remember all those men and women. And I would also like to thank Yoga Mamas for organizing this webinar. And I would like to thank you for taking the time to educate yourself and see how you can take care of your health and be in better form. Disclaimer, this webinar is for educational purposes only. It's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please always seek the advice of your health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have learned on this webinar. Who am I for those who don't know me yet? So my name is Aline Yon. I was born and I grew up in France. I'm of Chinese and Cambodian descent, and I have immigrated to Canada a few years ago. My degrees comprises of a bachelor's degree in life science from the University of Paris in France, followed by a master's degree in biotechnology management, both were earned in Paris. After that, I went to work for the pharmaceutical industry for 10 years at a global level. And after 10 years, I decided to change career. And when I arrived to Toronto, I went back to school at the Ontario College of Traditional Chinese Medicine, where I earned Traditional Chinese Medicine Acupuncture Diploma. I'm now registered with the College of Traditional Chinese Medicine Practitioners and Acupuncturists of Ontario, and I practice traditional Chinese medicine. Contents, what will we be talking about in this webinar? First, we'll look briefly at what is traditional Chinese medicine, then how traditional Chinese medicine can help you in your postpartum journey and help you or help your loved ones. Because ideally, this webinar will be watched with your friends and family, the people who would care for the new mom and the new baby. And last, we'll check how is a traditional Chinese medicine acupuncture treatment? What should you expect? First, what is traditional Chinese medicine? First, traditional Chinese medicine has a different perspective on health. Some of you might know this very well-known picture. Some of you would see a rabbit. Here you would have the head of the rabbit, and then here you have the ears of the rabbit, and here you have the eye of the rabbit. And some of you won't see a rabbit, but some of you would see a duck. So here you still have the head of the duck, the eye of the duck. And here, instead of the ears of the rabbit, you actually see the beak of the duck. What would I like to show with this picture? I would just like to show that depending on how we look at an object, in this case, a picture, we will see different things. And it's the same between traditional Chinese medicine and Western biomedicine. We both look at the human being, the human body, the human health, but we see things differently. And we both take care of your health with different methods, but the goal is the same, taking care of you and making sure you are in good health. How would both biomedicine and traditional Chinese medicine look at those symptoms? Cold all the time, low back pain, knee pain, urination issues like incontinence, or waking up at night to go to pee, or going to pee very often, low energy, and if you're in a postpartum period, you might experience all that. Low willpower, which means low motivation. For instance, you don't have the energy to get up in the morning to do things, even if you really want to do it. And if you experience night sweat, that could also be a sign of the symptoms I would like to describe. So how would biomedicine look at it? They say, oh, if you're cold all the time, or it could be an issue with the endocrine system. So they might send you to the endocrinologist, and they would say, oh, maybe you have something wrong with your thyroid. Low back pain and knee pain, they would say, oh, it's musculoskeletal issues, so they might send you to a specialist. Urination issues, it could be the urinary system, so they might send you to the urologist. Low energy, they would say, oh, it could be the endocrine system, so they would send you to the endocrinologist. Low willpower, they said, oh, maybe it's a psychological issue, so they might send you to the psychologist, or they would send you to a coach. And night sweat could also be the endocrine system. So they say, oh, maybe you should see an endocrinologist. And how would traditional Chinese medicine look at this? They would say, oh, all those symptoms, being cold all the time, having low back pain, knee pain, urination issues, low energy, low willpower, and if you will still have night sweat, even if you're cold during the day, but you have night sweat at night, oh, it's the same pattern. We call it kidney deficiency. So in traditional Chinese medicine, they would treat all the symptoms at once instead of sending you to different specialists. Traditional Chinese medicine is more than 2,000 years old. Why do I say that? Because one of the main books in traditional Chinese medicine is the Huangdi Neijing, the Yellow Emperor's Classic of Medicine. It's a book that is classified by the UNESCO, and it's a book that is more than 2,200 years old. And this book summarizes the theory and techniques, which means if this book that summarizes theory and techniques has been there for more than 2,200 years, it means the techniques and the medicine has been there even more longer. On the contrary, how was modern biomedicine born the way we know it now? Some sources say that it was born in the 19th century and it was pioneered by microbiologists like Louis Pasteur or Claude Bernard in France, for instance. Now, some people would say, oh, but acupuncture, traditional Chinese medicine is just a woo-woo medicine. That's why now they do something like medical acupuncture. But the bases are the same. It stems from traditional Chinese medicine theory and technique. And believe it or not, there were lots of studies, clinical studies published in China, China, Korea, Japan, but also in the Western world, and proving that traditional Chinese medicine and acupuncture works in fertility, for instance. I treat a lot of patients for fertility. I also treat a lot of patients for pregnancy, but also for chronic pain, cancer-related issues, depression, insomnia, constipation, fatigue, and so on. So now, how can traditional Chinese medicine help you in your postpartum journey? First, we'll do a little bit of theory. So if you understand better what's going on, then you will be able to be what we would say more compliant and taking care of yourself. And let's start. first, all of you know, most of you know this symbol, the yin-yang symbol. So you can't have night without the day. And within the night, for instance, you have a little bit, the night that is yin, you have a little bit of yang. For instance, you would have, some light in the night with the moon, for instance. And during the day, you have a little bit of yin. You will still have some darkness during the day. But what people would know less would be the 5-element theory. So for instance, we say water is the source of all life. And because water is the source of all life, they say water would generate wood because you need water to have wood and plants growing. And then you need wood to generate fire because you need wood to make a fire. And then when the fire burns, it burns into ashes, and the ashes are on the ground and it makes dirt. So that's why we say the fire would generate earth. And then within the earth, you would find ores of metal. That's why we say earth would generate metal. And then we would also say that a very tiny version of metals are ions. And when you put certain ions together, what do you get? You get water. That's why we say metal would generate water. And for life to happen, for life to be harmonious, whether in the environment, but also in your own body, they say we need those 5 elements working in harmony. So during pregnancy, what would be the 5 elements that would be working? So some of you have been my patients. So I usually tell you about your kidney meridian, which is also called the life meridian, because it's the meridian that keeps you alive and makes sure you're in good health. But because during pregnancy, you're making another life, this meridian, the kidney meridian, the life meridian, is working twice as hard. So we'll see that water will get a bit tired. And then the other thing during pregnancy, what happens during pregnancy, some of you would be more hungrier. And also we usually say that during pregnancy, you eat for 2. And I would like to add during pregnancy, but also lactation, you eat for 2. So the spleen meridian, the meridian that is in charge of the digestive system, the nourishing meridian, is working twice as hard. And at the end of the pregnancy, what happens? You have the delivery. And whether you are delivering in a vaginal way or via a C-section, a lot of energy is needed to give birth. And therefore, you will need to recover after giving birth. That's why in Chinese tradition and Asian traditions, and I know there's a lot of traditions around the world, they all say that the first month, the first 40 days postpartum is very important for the new mom. And why? Because especially if it's your first child, because in traditional Chinese medicine, they say that the postpartum period that follows the first child is one of the most important for a woman's life, because it's during that period, if you really take care of your period, your health can improve dramatically. So what do we need to do during the first 40 days postpartum? I usually say you only have to do 3 things, or 2, but 3 things if you're breastfeeding. First is rest and sleep. Please do sleep as much as you can while your baby sleep and things like that. Cleaning and cooking ideally would be done by somebody else. So I hope you have help in the form of friends, family, or even a doula to help you during this critical period. And then, because you need to recover from all the energy spent in pregnancy and delivery, you need to nourish yourself. And the best way to nourish yourself is eat easy to digest food. And by easy, you will have to avoid raw and cold food and instead eat warm and cooked food. Why? Because technically, so whatever you eat and whatever you drink, the body would bring all your foods and your drinks at the body temperature, which is 37 degrees Celsius, before the body starts to digest it and absorb it and transform it into energy for you to recover. So if the food is cold, then your body will use up energy just to warm up the body. But if the food is warm, then it's more energy for you and less energy to just warm up the food. And raw food is and cooked food is technically, cooked food is pre-digested food. So that's why if the food is already pre-digested, then it's easier on your digestive system. That's why for people who are tired, especially during the postpartum period, I would usually tell my patients, please avoid raw and cold food. It's easy to digest warm and cooked foods. And the ideal food would be bone broth if you eat animal products in your diet, dark leafy greens, and ginger. And for those who are vegetarians, eat beans and seaweeds and yeah, eat broth. And the last thing that you would need to focus on the first 40 days, apart from sleep and eat, it also feed baby. And that would be the 3 things you should do during your postpartum period. The rest should be delegated to somebody else. So recover for the first 40 days. The other advice I would give to my patients would be make sure that you keep warm. By keeping warm, make sure you wear socks, and socks that goes above the ankle, because at the ankle you have very important acupuncture points that should never get cold, because they're part of the kidney meridian, and the kidney meridian is also the life meridian, but also the central heating of your body. So you need your socks, your feet warm. That's why I would say wear socks, and also wear a scarf. Because after you have given birth, you're very vulnerable. It's how I would compare that. For instance, a woman who has given birth, she transitions from a maiden's body into a mother's body. So it's like a caterpillar. When the caterpillar would be your maiden's body, and when you're pregnant, it's like the caterpillar is in the cocoon. And when you have given birth, it's like the caterpillar getting out of the cocoon and becoming butterfly. And when the butterfly is just out of the cocoon, the butterfly is very, very vulnerable. So that's the state you will be right after giving birth. That's why they say wear a scarf, don't get cold, keep warm, because they say the disease comes enter in via some wind points, which are points at the back of the neck and at your shoulders. That's why they say wear a scarf. And I know in China, some people would say like, don't like have a shower for 1 month. It's because back in the days, they didn't have hot water. And if you have a shower in cold water, you would catch a cold. So what they would do, they would wipe themselves with a sponge. So we are in the modern world. So of course you could have showers, make sure they're warm, and make sure that right after the shower, you dry yourself properly. So no sweats, and that you dry your hair properly with a mild warm hair dryer, because if it's too strong, you might also catch what we would call a wind cold. And the other thing in our modern world is please do avoid screens, because in traditional Chinese medicine, they say that staring would injure your blood. So if you're staring at a screen too much, if you're reading too much right after giving birth, it would injure your blood. But you need that blood first to recover, but also to make milk, because milk is made by filtering the nutrition from blood. So I know there's a webinar here, and maybe some of you have are attending, because I invited you right after your postpartum period, but make sure you limit your screen time. And that, last but not least, during your postpartum period, please do get help. Ask for help from anybody who is kind enough to offer it. Somebody who would cook for you or bring food to you, somebody who would take care of your baby when you have your shower or just rest, help from in the form of a mother-in-law or sister, a friend, or a doula. Please do get help. The first 40 days after giving birth are very important. And if you're interested in that, and if you haven't read the book yet, The First 40 Days here from Heng Wu is a book I would recommend, and it has tips and recipes. And I don't get any commissions from that book, so feel free to go for it. And I think they also sell it at Yoga Mamas. Why would I tell my patients to recover for the first 40 days? First, if you take care of yourself in the first 40 days in traditional Chinese medicine, they said you will be healthier because you will get energy faster, and because a healthy mama also would be able to take care better of her baby, then a healthy mama would get a healthy baby, and you would have a healthy bonding. And researchers have shown that a healthy bonding and early bonding between the parents and the babies nurtures good health for the babies later. And also why postpartum period is important, because we want to avoid postpartum depression, because if you are depressed after giving birth, then the bonding with baby would be jeopardized. And last but not least, maybe some of you noticed that Asian women's age very gracefully. They're in their 50s and they look so young and so on. And in Asian traditions, they say it's because they have taken care of them right after giving birth. And they say that if you don't take care of yourself after giving birth, you might not feel it now because you're young and healthy, but in the old age, around menopause and so on, you would really feel it and age very fast. And why is it even more important to rest in the winter? So according to the Yellow Empress Classic of Medicine, it's a book that is at the basis of a traditional Chinese medicine, and encourage you to live to tune in with the seasons. And they said that during the winter months, all things in nature wither, hide, return home, enter a resting period, just as lakes and rivers freeze and snow falls. This is a time when yin dominates yang. Therefore, one should refrain from overusing the yang energy. The philosophy of winter is one of conservation and storage. Without such practice, the result will be injury to the kidney energy. And kidney energy, if you remember, it's the life meridian. So in the winter, you should really rest as much as you can to preserve your life energy. So in the winter, it's a time to hibernate. And look at this cute little animal. And hibernation comes from Latin hibernare, which means to pass the winter. And how would animals pass the winter? They would eat and sleep. And that's what you should do even more now that you're in a postpartum period. So tips for you, cook food-wise. So postpartum and winter is the time to have soups and roast food. So the cooking should be longer at lower temperature with less water. So the slow cooker is the best way to have winter food. And there are food to strengthen the kidney meridian, which is, I repeat, your life meridian. So there would be seeds in the shape of kidneys, like kidney beans, adzuki beans, lentils, quinoa, anything that is in the shape of a kidney. So if you eat animal products, you could even eat organic kidney organs, because organ meat should be very good quality meat, bone broth or royal jelly, and you should eat a lot of dark or purple food, blueberries, blackberries, black rice, black sesame, and black beans. And make sure if you eat beans, make sure to soak them overnight with baking soda, and then the next day you would rinse it and you would cook them with a piece of seaweed, kombu. So it's easier to digest. Other food that are recommended during the winter, so we already talked about quinoa, but other type of food that we consider in Chinese medicine bitter, like oats too. So porridge in the morning is a very good idea. So if you're my patients, I would always tell you, like, eat warm in the morning, and porridge is a great idea. And other foods that are recommended would be asparagus, celery, endive, turnip, and with precautions, burdock, chamomile tea, unsweetened cocoa, and citrus peels. And then winter is also the season where salty food should be taken more, so millet or barley and seaweeds. And if you crave more salt, add more salt, but please use that with cautions, because too much salt is not good for your health, as I'm sure you know. And you should use seaweed with even more caution if you are cold all the time. And And if you're cold, you would eat warming food like walnuts, black beans, and the onion family, garlic, onion, chives, scallions, and leeks. And those would also help you with your immune system and help you prevent you from getting cold and catching a cold. Warming spices would be appropriate during the winter. Spices like black peppercorn, dried ginger, cinnamon, clove, fennel seeds. So that's why, during the winter, you have all those, eggnog and wine with like warm wine with spices. Please use those warming spices with caution if you have night sweats. If you're too cold, use those warming spices, but if you have night sweats, I would say try to avoid that. Maybe add some ginger, but avoid the rest. Other warming food, if you eat animal products, would be chicken or turkey, because turkey in Chinese medicine, it's called fire chicken. So it's a very warming meat. Game and lamb, they're the warmest meat, and trout and salmon. Again, if you have night sweat, those should be eaten with, caution, especially lamb and game and turkey. And maybe you notice that all those warming food, they're the food that we eat in the winter for a reason. And for Christmas, for instance, you have to keep the turkey. It's because it's warming. Now, you have done everything, you've rested, you are eating well, cooked and warm food, but you're still tired. So how can traditional Chinese medicine acupuncture can help you, and where could we help you? First, you remember the 5-element cycles? So postpartum wise, you can see the spleen meridian is working twice as hard because you need to nourish yourself and baby. So if you have lactation issues, digestion issues, low appetite, you're tired, you have anemia, you have pelvic floor issues with incontinence, that could be your spleen meridian is in balance and a bit tired. And the liver meridian, they say it's the meridian that is the reservoir of blood, which also controls the emotions because you have hormones in the blood. So if you have migraines, you have vivid dreams and joint pains, and if you are stressed out and irritable, maybe your liver meridian is not happy. And speaking of emotions, the heart is the emperor of emotions. So if you have insomnia, emotional issues, and postpartum depression, then your heart meridian is unbalanced. And we've just finished the autumn season according to traditional Chinese medicine. So if your lung meridian is weaker, then you had the respiratory issues with your immune system, skin issues, you have issues with grief and letting go. That's the metal meridian. And last but not least, if you have back, knee pain, night sweat, you are too cold or too hot, you have urinary issues, your limbs are all swollen and you can't fit your shoes anymore, or you have pelvic floor issues, it's the kidney meridian that is tired, it's the life meridian. So even if after all you do for eating and sleeping, you're still tired and you still have all those issues, it's time to go to traditional Chinese medicine acupuncture. And how we can help, first, like this is the winter, is the time to really take care of the life meridian. So if you're too cold, if you have issues with knee pain and back pain, make sure to come for a consultation. So traditional Chinese medicine acupuncture can help with the spleen meridian, with better lactation, better digestion, a smooth weight transition, better energy, and healthier pelvic floor. For pelvic floor, I would also recommend you to do at the same time as traditional Chinese medicine acupuncture, to go a pelvic floor physiotherapist. So it's nice to work on the muscle level, but also on the energetic level. For the liver meridians, we will make sure that your headaches are reduced, are less painful, that you have a nice, more tranquil mind, and you have no more pain, that you would sleep better by taking care of your heart meridian and your emotions, that would have a peace of heart and better bonding with the baby. And for the lung meridian, because I know it's the pandemic, so we'll take care of you to have a better breathing, we'll strengthen your immune system, you would have a better skin, and it would be easier for you to let go of your old life. Especially for new moms, first-time moms, maybe it's a bit difficult because, when you're a mom, there are things you don't do the same way as if you don't have children. And last but not least, kidney meridian. We make sure you have no more pain, no more night sweats. I usually tell my patient night sweats is the first thing I check her of, because we don't want leakage of fluids. You would have a more regulated temperature, not too cold, not too hot, better urination, no more night peeing, so you would sleep better. It's one thing to get up at night because of the baby, but it's another to get up at night to go to pee. No more swelling, a healthy pelvic floor, and better potential for the next baby. And even if you don't want a next baby, again, kidney meridian is a life meridian. So we want to make sure that you stay in good health for the rest of your life and that you would age gracefully. So postpartum traditional Chinese medicine acupuncture helps you to recover and better bond with baby. Now, how does an acupuncture treatment works? First, traditional Chinese medicine acupuncture is pain-free. We use very, very thin single-use sterile needles, and the needles are so thin that we could fit at least 10 acupuncture needles in a hypodermic needle. So, which means the needle they use to vaccinate you, you can put at least 10 acupuncture needles in that. That's how thin the acupuncture needles are. And during insertion, you might feel a prick like a mosquito bite, but afterwards you shouldn't feel any pain, because after all the needles are in, you should be able to relax and fall asleep. So, and if it's painful, you won't be able to relax and sleep. What does a traditional Chinese medicine acupuncture treatment look like? First, I would take care of asking you your holistic health history. I would ask you about your physical symptoms, if you have pain, what time, and if you sleep well and so on, your emotions, because any emotions you would have, because in Chinese medicine, we don't separate the body and the mind. It would tell me about what to treat, what meridians that would be affected. I would ask you about your lifestyle. I know after giving birth to a baby, sleep is disrupted, but I'm also interested in what you eat and what time and so on. And if you're hungry, I would look at your diet. And last but not least, I will check your pulse and check your tongue. So in a traditional Chinese medicine consultation, it's the only time when sticking out your tongue, it's actually polite. Well, it's required. It's not impolite. It's not rude. It's required, because your tongue would tell me how you are health-wise. And then I would check your pulse on both your wrist, just like this lady is doing. And then once I have your health history, I will have a diagnosis for you, and then would come the time of treatment. So first we'll do acupuncture, but we could also do moxibustion. Moxibustion is burning mugwort, because when you burn mugwort, it burns at a near infrared wavelength that is similar to the one of the bodies, and that would speed up some reactions inside your body. You could also do gua sha or cupping. I would give you lifestyle and diet advice. I could do tuina massage. Or me or my colleagues, like one of my colleagues, Ingrid, is really good at tuina and cupping. I don't prescribe herbs yet, but two of my colleagues, Teresa and Daniel, are prescribing herbs. And once all the needles are out, what you do, it's time for you to relax and rest. And usually you would have a needle retention for about 20 minutes to half an hour. And during that time, a lot of patients usually fall asleep. That's how relaxed they are. Now, how often when would you come for traditional Chinese medicine acupuncture treatment? You would come each time you have pain or discomfort, tired or cold, each time you don't feel great. Ideally, you would come 4 to 6 weeks postpartum, because before that, ideally, you would stay home and recover. Unless there's an emergency, I had patients who came like 2 weeks after giving birth because they were such in pain, and that's okay too. Just make sure if you come before the 4 or 6 weeks postpartum, that you really bundle up yourself, and wear a scarf and wear socks that cover the ankle, and wear boots, because those are the region of your body where you shouldn't catch a cold. How often would you go? At the beginning, you would come twice a week for the first 1 or 2 weeks, and then it would be once a week. And how long you would come? Once a week until your issue is resolved. Sometimes it's just resolved in 4 to 6 sessions, and then depending on your condition, you could have a follow-up after once a month. Because again, traditional Chinese medicine, ideally, they are here to fine-tune your body so you wouldn't you wouldn't get sick. So we keep you in good health. Of course, we can also treat you if you are sick, but ideally we would keep you in good health as long as we can. Now, bonuses to keep healthy and happy. So if you have the goal from your pelvic floor physiotherapist, and usually 4 to 6 weeks after giving birth, you could do the Meridian Gym to keep stress at bay and optimize your health. When would you do it? You would do it in the morning if you're stressed out or tired, because this Meridian Gym would give you energy. It's based on the traditional Chinese medicine meridians. Please do not do it before going to sleep and not right after eating, because right after eating, you want to digest. You don't want the energy to be taken away from your abdomen. And don't do it before going to sleep because, you know, it's energizing. And this Meridian Gym, it's less than 20 minutes. So if you're interested in it, you have the link here at Yoga Mamas On Demand TV. Or if not, you can just take a picture or flash explore the QR code that would bring directly to the Meridian Gym. So please make sure to take a picture of that slide. And the other thing, I've just covered postpartum period in the winter with traditional Chinese medicine. Last year, I did another one for general health. So your whole family can benefit from it, and you have much more theory for those who are interested in traditional Chinese medicine and understanding how it works. And it's called Preserving Your Health in Winter with Traditional Chinese Medicine. It's on my YouTube channel, or you can just go on YouTube and type my name, Aline Yon, or just use that QR code or that link here. Oh. Looks like I can't. Anyway, that's the end of the presentation today. Thank you for joining. And if you have any questions, please feel free to type them in the chat. Looks like I have an issues with my screen. So for those who are interested to see me as a practitioner, my name is Aline Yon. I'm a registered traditional Chinese medicine acupuncturist. I worked at Yoga Mamas on Tuesdays and Saturday. So you can write to me at this email address, alinyon@yogamamas.co, and you could visit Yoga Mamas website here and call them at this number. And last but not least, you will have this QR code, so you have information on my webinars, my replays, the Meridian Gym, how to book an appointment with me. Yeah, that's all for today. I will stay a few more minutes. Oh, there's a comment on the chat. And if you have any questions, please let me know. Oh, you're welcome, Heather. I hope you're well. Okay, I don't think there was any questions. So thank you for being here today. Take care of yourself and feel free to contact me should you have any questions. Take care. Best